Brownie? Where's my dog? Where's
He's
my
okay.
dog? He's
I've
not
been here all day. He was fine this morning, and this afternoon it's not going so well.
Okay.
He's not very alert.
I've never met him before. Does he, I read his chart and he has Alzheimer's dementia?
That's correct. He's been here about a month.
Oh, okay. Was he ever like this before?
No, not really. He's deteriorated since.
Okay. Let me ask him a couple questions. Mr. Jones, wake up for me. Mr. Jones, tell me what day of the week this is.
Friday.
That's right. Today is Friday. Now tell me what year this is.
Friday.
Okay. Would he normally get that question?
No, he really wouldn't. He usually goes back to like the 1950s, you know,
Where's
repeats it
Brownie?
all the time.
Where's Brownie?
Don't worry about Brownie. He's fine. He's at home.
But at least he would say a year. Let me try
Yeah.
that one time. Mr. Jones, what year is this?
I don't know where my dog is. I don't know where he is.
He's
I
at home.
find
Let me try one more thing. Mr. Jones, if today is Friday, what was yesterday?
Friday.
Okay.
Friday.
If today's Friday, yesterday would be Thursday. What's the day before Thursday?
Saturday.
Okay. I'm going to try one more thing. The somnolent or lethargic type of delirium is often the most dangerous type because it's often the most unrecognized or missed type. People can go days, sometimes longer, and just be labeled as sleepy or fatigued. So the confusion assessment method really is objective criteria that helps you diagnose delirium when it first begins.
Tuesday. Saturday.
Good. We're going to try it one more time. Mr. Jones, if today is Saturday, I want you to say the days of the week backwards, starting with Saturday.
Saturday. Friday. Saturday.
Okay. One more thing. I would like to try just one little other test here. I'm going to say some letters, Mr. Jones. When I say the letter A, I want you to raise your hand. A. Okay. Of the somnolent lethargic type of delirium, it's pretty clear once you use the CAM. You get a good history from the wife that something has changed recently. He's fluctuating because the wife says he wasn't like this morning. Okay. You get attention tasks. The attention tasks I do, he cannot complete the attention tasks, so that's inattention. He's disorganized. I don't have to ask specific disorganization questions. I asked him orientation questions. And instead of giving me the wrong year, he gave me a very disorganized answer. He kept on the days of the week or the dog. The hyperalert or vigilant type of delirium is rarely missed. This person's usually labeled with agitation. But if you look at the clip we're about to see, the patient's eyes are vigilant. He may not be agitated, but his thinking is just vigilant. So it's as important in this type of patient to do the attention tasks, as you'll see. He's able to start it, but his inattention won't allow him to complete the task.
Okay.
Good. All right, let me just a couple more questions and then we'll figure out a way to find Brownie. Tell me what day of the week this is.
Friday.
Right. Now tell me what year this is.
Friday.
Okay. One more question, then we'll figure out what to do. I want you to start with Saturday and say the days of the week backwards.
Saturday. Friday. Saturday. Sunday.
The mixed type is another common type of the three types of delirium. What you'll see in the clip is that during part of the interview, he's more lethargic or somnolent. Then he becomes hyperalert, and then he trails off during one of the attention tasks. Mr. Jones, I want to try one other thing. I'm going to say a string of letters. When you hear the letter A, Mr. Jones, when you hear the letter A, I want you to raise your hand. A. Good. B. D. T. A. Some patients with delirium may not meet all the criteria for delirium. If they have one or two components, we would call this subsyndromal delirium. We think this has a bad outcome too, because if you don't pick it up early, those people could go on to have full-blown delirium, and again, the medical causes could be overlooked. The clip you're about to see, the patient looks maybe his baseline, except when we do the attention tasks, he's unable to complete them.
I think there's something wrong.
Really? In what way?
He's just not acting the way he normally does,
Physically or more thinking-wise?
thinking-wise.
Okay. Well, I need to ask you a few questions. Some simple, some a little more difficult. What day of the week is this?
It's Friday,
Good, good. And what year is this?
1955.
Okay, is that where he is? He's been for a
yes,
few years?
that's where he's
Okay.
been.
All right. Now do something else for me. I want you to start with Saturday and say the days of the week backwards.
Saturday, Friday, Saturday, Sunday, Monday, Tuesday, Wednesday.
Okay, good, good. Now let's do it this time. Start with Saturday and say the days of the week backwards.
Saturday, Friday, Friday.
I would leave it at this. Delirium is such a dangerous diagnosis, and screening for mental status changes. Screening for the possibility of delirium is so important that mental status should become that sixth vital sign.
The SNAC is just what it sounds like. It's about food, and SNAC stands for the Simplified Nutrition Appetite Questionnaire. We recommend that anybody over the age of 60 who comes into the office should be administered the SNAC because it's a preventive questionnaire. The idea is to identify people who are at risk for losing weight within the next 6 months. Mr. Myers, how nice to see you.
Thank
I'm
you.
Dr. Tomosa.
Hello, doctor.
How are you doing today?
Oh, well, not too good, but I'm all right, but I'm not feeling too well.
Not as good as you usually feel.
That's right.
Oh, okay. Well, let's see if we can get to the bottom of that.
Okay.
I have a few questions that I'd like you to answer for me. And what we're checking right now is to make sure that you're getting enough nutrition. I want to ask you a few questions today about your appetite. I want to know whether or not you are at risk for losing weight over the next 6 months or so, because this is the sort of thing we worry about. If you're not getting enough nutrition, then your immune system begins to fail and you don't feel very well. Since you're not feeling very well today, I'm a little bit concerned about that.
Okay.
So
ask
I'm going
him.
to, oh
That's
great,
fine.
good. I'm going to ask you, I'm going to make 4 statements and give you 5 possible answers. Just tell me which one of those 5 answers best represents the way you feel.
Okay.
All right?
Sure.
Ready?
I'm ready.
Okay. My appetite is very poor, poor, average, good, and very good.
Recently, it's just been very poor, I think.
Really poor.
Yeah.
Okay. When people lose about 5% of their weight in 6 months, then they become at risk for a weakened immune system and osteoporosis. Their bones become quite weak and they become frail, they become anorexic, and they become malnourished. The SNAC consists of 4 questions. Each question has 5 possible answers, listed A through E. The A answer is worth 1 point, the E answer is worth 5 points. So to take the whole questionnaire, the patient could get a maximum score of 20. If they answer A for each of the 4 questions, they have a minimum score of 4. What we're concerned about is that patients who have a score of 14 or less are at risk for developing weight loss of greater than 5% within the next 6 months?
Recently, it's just been very poor, I think.
Really poor?
Yeah.
Okay. All right.
Afraid so. And not for a long time, but it's getting gradually more and more
So this is
poorer
just
and
beginning
poorer.
then.
Yeah.
Okay.
Yeah.
All right. Well, this is a good time for you to take this test then.
Okay.
All right. Food tastes very bad, bad, average, good, or very good?
Let's see. What's the first one?
The first one was very bad,
very bad.
followed by bad.
No, it's not very bad, but it's not good. I say it's bad most of the time.
Bad most of the time. All righty. Okay. So when I eat, I feel full after eating only a few mouthfuls. I feel full after eating about a third of the meal. I feel full after eating over half of a meal. I feel full after eating most of a meal. And I hardly ever feel full.
I'd say a third.
A third.
About
okay.
a third.
So you would say, I feel full after eating about a third of a meal.
Right. I start, and then it doesn't taste good, and it's I feel like I want to stop, so I feel full.
Okay. All righty. Then the last statement I want you to give me an answer to. Normally, I eat less than 1 meal a day, 1 meal a day, 2 meals a day, 3 meals a day, or more than 3 meals a day.
Well, I try to eat more than once, but I'd say on the average, maybe just 1 meal. You know, if I eat all the meal,
Right?
just once.
So
And maybe a
about-
little snacking, but only 1 full meal a day,
Okay.
I would
so,
say.
All right. So I'm going to put you down for one meal a day then.
Okay.
Okay. Well, in looking how you answered your questions, I would have to say that I'm a little bit concerned about you. And maybe this is why you're not feeling so well. So the snack has now done its job. The patient has been identified as being at risk for weight loss within the next 6 months. We have now plenty of time for the healthcare team to step in and intervene to fix whatever it is that's causing the problem, so they will prevent the weight loss before it even happens. This is a case of an ounce of prevention is worth a pound of cure.